Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Your little ones are in constant motion. They're running around the house, they're running around outside. Toddlers are a ball of energy. But what happens when they get injured? What kind of injuries can you treat at home? When do you need to take them to see the doctor or the emergency room? Joining us to talk about this is Dr. Livpreet Singh. She is a pediatrician with the Scripps Coastal Medical Center in Chula Vista, California. Doctor, thanks so much for being with us.
Thanks for having me, Susan.
So what are the most common types of toddler injuries? Let's start off with the skin.
So in regards to the skin, abrasions, cuts, burns are common childhood injuries. So in that case, what you would do is, first of all, remain calm, remove your child, put them in a very safe area, assess the area. If there's any overlying cloth or clothing on there, then remove that. Run the burn or laceration or abrasion under water, lukewarm water, and clean that area. And then afterwards, kind of take a look at it. So in regards to burns, if there are any blisters in that area, you would want to go see a medical professional just to have a second look and make sure that there's no treatment that's needed. If there are no blisters for the burn, you typically can manage this at home. In regards to abrasions and cuts, it kind of depends on how deep it is. If you're seeing the muscle underneath, or, hopefully not bone, but if you're seeing that, then they need to be seen at the emergency room. But if it's a very superficial abrasion or cut, that's something that you can manage at home. You would just want to ensure that you clean it daily and then put an ointment on top. So typical ointments that people use are Neosporin, aloe vera, vitamin E serum, and that helps with the skin healing process. So you can certainly manage that at home.
And how do you prevent these type of skin injuries?
So in regards to scald injuries, the American Academy of Pediatrics actually recommends setting your water heater to 120 degrees Fahrenheit or below. And then if you don't have control over your water heater, you can use an anti-scald device on your faucet, so it automatically turns off if it gets too hot. So that in itself prevents a lot of unintentional burns.
And then what about bones and joints? Let's say, the kids get their fingers caught in the door, or maybe they fall off a bike. What about those injuries?
Yeah, so if there are any obvious deformities there, so if you notice that a bone is poking out where it's not supposed to be poking out, then of course you need to go see a medical professional. But if it's just a little bit bruised, a little bit swollen, continue to monitor that at home. Put ice packs in the area, allow it to rest. And if it continues for 3 to 5 days after the inciting event, then you would want to go see your doctor and make sure that there's no underlying fracture.
And if you see a bone, if the bone's out of place, do you want them to go see the doctor or go to the emergency room?
Go to the emergency room.
Okay. And then how can you prevent these type of bone and joint injuries?
Great question. So in regards to bikes, you would want to make sure that they're wearing helmets and then pads over their elbows and then their knees as well. In regards to crush injuries, meaning that they get their fingers slammed in a door, things of that sort. So now they have slow closing drawers and cabinets that you can install into your home. The other thing, whenever you're closing a door, just be vigilant of where your child is. Just keep one eye on your child and then the other while closing, just to ensure that they're not in that vicinity.
And what about impact injuries? Let's say your child falls down the stairs, for example, and they hit their head or they hit their wrist or something.
Yeah, so head injuries are important to, assess the mechanism of injury. So meaning that, what was the height of the fall? Did they have any loss of consciousness? Are they having persistent vomiting afterwards? So persistent vomiting, loss of consciousness, and then any altered mental status, meaning that is your child behaving abnormally? Those are red flag signs, and you need to go see a professional in the emergency room.
And then what about preventing these kind of injuries?
So I highly encourage parents that as soon as your child is mobile, get on their level and see what could be potential hazards in the home. So making sure that you have child locks for every cabinet and drawer, putting stair gates, not only at the bottom, but also at the top as well. And just ensuring that all the areas that they could potentially get into do not have anything that's hazardous that could cause them an unintentional injury.
And what about foreign objects? Let's say they swallow something that they shouldn't, or maybe they're choking on something, accidental poisoning.
Great question. So for accidental poisoning, I recommend all my parents immediately put in, once they see me, I tell them, go ahead and put poison control in your speed dial. It should be in all of your phones. And, if you don't know the number, I haven't memorized by heart.
Let us know what it is. Tell us.
Yeah, it's 1-800-222-1222. And essentially what you want to do is whatever they got into, whether it be a medication or another object, have that on hand. That way you can tell the medical professional on the other line exactly what they took and the strength of it in regards to the medication. That way they can properly assess the severity of the ingestion. So I highly recommend parents already putting that into all of their phones just in case of emergencies.
And what about preventing this type of injury with foreign objects?
So foreign objects, I recommend that, any toy that can be pulled apart, supervise them when they're playing with it. And then, anything that also has a battery in it, because battery ingestions are very hazardous, supervise them when they're playing with the toy. In regards to choking on foods, just making bite-sized pieces of whatever food they're eating at that time. Boil or heat the food so it becomes soft consistency and they can't choke on it would be my other recommendation. And then, of course, I would recommend every parent to be CPR trained. Yeah, just in case of an emergency, that you can kind of assess the situation and take the initial steps while, the medical professionals are getting there onto the scene.
Where can you get that CPR training?
So you can go to the Red Cross website and look up under your county where they provide those classes, whether it be CPR or first aid. Those are good resources for you to find those classes.
The bottom line, doctor, is there anything that you should, look at with regard to any of these injuries and go, I can actually take care of this at home, or no, I really need to get my child to the ER?
So severe burns, deep cuts, significant falls. Again, we talked about mechanism of injury and those red flag symptoms that I mentioned before. All of those would warrant an emergency room visit.
Any final thoughts, doctor?
So your children are on the go and, they're going to get into quite a few things. So just making sure that you baby proof as soon as possible and really get on their level and see exactly what could be in their vicinity that could be a hazard. And, and look out for those red flag symptoms that we talked about, because those would warrant an emergent evaluation. And we want to keep your kids safe.
Yes, we do. Doctor, thanks so much for being with us. We certainly appreciate it.
Thank you so much. I appreciate it.
If you'd like more information on how to treat common toddler injuries, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks for joining us.